Hi Cassie, my name is Marianne. I'm going to be your nursing assistant student today, and I'm here to provide catheter care for you. Is that okay?
Yes.
That's great. I am going to ask your visitors to step out, and I'm going to wash my hands. And then I'm going to check your ID. Can you give me your name and date of birth, please, Cassie?
Cassie 98.
Thank you. And then I'm going to pull the curtain, check the locks on the bed, and collect my supplies. First I have a barrier. I have 6 washcloths, an additional towel, a bath blanket, a pad, and then I'll get my basin with soap. My pair of gloves. Before I actually raise the bed, I'm going to get my water, use the barrier to turn on my tap, make sure the temperature is good, turn off my tap, and then I'm going to get Cassie to check the water temperature. How is that, Cassie?
Good.
Thank you. Okay, I think now I am ready to raise the bed up to working level so I don't strain my back. Okay. I'm going to put my gloves on. I'm going to put a bath blanket over you, Cassie, just so that you can stay warm and we'll keep you covered.
Okay.
We'll keep your regular sheet dry and clean. Again, for this procedure, I don't need the bath blanket to necessarily be neat and tidy. I just need it to cover, okay? I'm going to pull the regular sheet down to knee level. And then I am going to put my pad underneath. And for the catheter skill, I need to put the pad under, but there won't be one already there like it was in pericare. So I'm going to prepare my pad, roll it just a little bit to get it ready, and then Cassie, I'm going to have you scooch toward me and roll away from me. I'll put the pad underneath to protect the bed sheets from getting wet. Okay, I'll go around to the other side. I'll have you scooch towards me and roll away. That's to keep you centered on the bed. And I'm making sure that I'm not hooking the tubing on anything. There are no kinks in the tubing. I'm checking that. The catheter is well placed. And it's attached to the bed frame, not the rail. Okay. I'm going to scooch your gown up together with the bath blanket to keep it out of the way. And I will put a towel between your legs for drying purposes and to keep your legs dry. I have 6 washcloths. I'm going to put them in the basin, and I have my soap prepared. So I'll take my first washcloth and I'll wring it out. And just like pericare, I will put soap on 3 leaves of my first washcloth. And I will pull out 1 leaf. And for this skill, it's very important that you stabilize the catheter so you're not pulling on it at all. You're going to take 1 swipe down the middle of the labia, get rid of that leaf. Pull up the second leaf, again stabilize, down 1 side of the labia, get rid of that leaf. The third leaf, stabilize the catheter, and third swipe down the labia. I have my linens close by. My second washcloth, I'm going to put soap on 2 leaves. I'm going to fold it, pull up the first leaf, get the catheter out of the way, wipe the groin, get rid of that leaf. Stabilize the catheter, wipe the other piece of the groin. For my third washcloth, I'm going to put soap on all 4 leaves, and this one is to wash the actual catheter itself. And I'm going to take 4 swipes. As soon as I've taken a swipe, I won't use that leaf for anything else. Again, I'm going to stabilize right at the meatus, and I'm going to gently clean away from the body. Pull up the second leaf, clean away from the body without stretching or tugging on the catheter. Third leaf, and fourth leaf. All of these washcloths have been with soap. So I've soaped everything up, and now I'm going to rinse. So this cloth has no soap on it. I'm going to use the first 3 leaves to do the labia and rinse, remembering to stabilize the catheter. 1 swipe, 2 swipes, and 3 swipes. The next one is for the groin. 1 swipe, 2 swipes, and the last one is for the catheter itself. 1 swipe, 2 swipes, 3 swipes, and 4 swipes. Get rid of that. Now I'm going to pat dry, starting at the top, going towards the bottom, and then use a different part to dry the catheter itself. Get rid of the towel, pull down the gown, and I want to get rid of the pad underneath, so I'm going to pull towards myself, roll away, and I'm going to roll up the pad, tuck it underneath just like bed making. And then I'll have you lay back down, Cassie, and you're going to roll over a bump. I'm going to come to the other side of the bed. Scooch toward me, roll away, and I'm going to make sure not to hook on the tubing at that point in time. There we go. Okay, and I'm going to take the blanket, and if I don't want to touch the clean sheets with my gloves, I can grab them with the inside of the bath blanket. I'll get rid of this in dirty linens, remembering not to touch them against my uniform. I'm going to lower the bed at this point. Is there anything else I can get for you, Cassie?
No, thank you.
Good. I am lowering the bed. It's still in locked position and safe. I'm going to get rid of my water. Use a paper towel to rinse the basin. Use a clean towel to wipe the inside. Clean towel to wipe the outside. Towel to hold on to the basin. Towel to put the soap back in and open the drawer. And get rid of those towels. You can get rid of my barrier at this point. Would you like a drink?
No, thank you.
I have missed the call light too, so I'm going to grab that. Make sure that is in reach on your strong side. There we go. And we already checked the tubing before to make sure it wasn't kinked. If I'm concerned about touching things, I can use a barrier to get the table in place. I can use that same paper towel to move the curtain out of the way, and at that point I'm removing my gloves anyway. And I'm going to wash my hands. Invite your family back in and jot down any charting.